Prime Minister Justin Trudeau is not backing the decriminalization of the simple possession of drugs as a public health response to Canada's escalating opioid crisis. That's despite calls to do so from public health officials and the Canadian Association of Chiefs of Police. Here's the Prime Minister when asked about this earlier today.
Well, I think in any crisis like this, there is not one silver bullet. I think we know that there are massive, different angles and perspectives on this that we have to take. The key to decriminalization, as you pointed out, is making sure that there is a safer supply for people who are struggling with addictions. And that is what we've moved forward on without having to take the step to decriminalization.
The opioid crisis, of course, has hit British Columbia particularly hard. Over the course of May, June, and July, illicit drug overdoses have claimed the lives of 526 British Columbians, more than double the number of deaths in the province due to COVID-19. To dig a little bit further into this issue, I'm joined now by Hetty Fry. She's a Liberal MP representing Vancouver Centre. She joins us from Vancouver. Hi, Dr. Fry. Good to see you. Thank you very much for making time for the program.
It's my pleasure. Thank you, Vassie.
You know, and I know that the Prime Minister did a number of local media interviews today in British Columbia and was asked quite frequently about the opioid crisis. Before I ask you about what potential solutions your government should or shouldn't be looking at, I just wanted to know, as someone who's represented one of the hardest hit areas for so many years, how concerned are you about the statistics? And by statistics, I mean the number of people who have died from overdoses in the past, during this pandemic, I should say.
Well, this has been an issue for me even before I became an MP, because I was a physician and I had to deal with this. But when I became an MP, I was very involved in the very beginning when we started the Vancouver Agreement, a tripartite agreement between government to deal with overdose deaths then, and that was like 400 a year. And so we put in place harm reduction, and we were the ones who actually started the safe injection site that you now see was the only one working in Canada for so many years after the Harper government didn't want it.
So what is your level? I mean, you're talking about 400 a year. We've seen more than 175 in each of the last 3 months. More people in BC in those months have passed away from overdoses than from COVID-19. So if you were to assess how the problem was bad for a long time, but how bad things are right now, what would you say?
I would say I think it's at the highest it's ever been.
And what does that say to you?
Well, it says to me that actually we had brought down overdose deaths in Vancouver to zero when we first brought in the safe injection site and a whole lot of other programs and policies to deal with it in 1998. But since then, for 10 years under the Harper government, this was in abeyance. Nobody was doing anything about it. We couldn't expand it or anything. And over that period of time, an increase in the overdose deaths began to pile up again and again and again. And not only that, we're now seeing that actually the opioids are being cut with fentanyl. It was being cut with carfentanil. We're now finding that people are adding benzos. And in Vancouver, what's happening is because you can't get a supply on the street anymore, people are making it in their kitchens. People who have absolutely no knowledge of what they're doing. So it's even more dangerous.
I take your point, Dr. Fry, certainly on the criticism that was leveled at the previous government, but there's also criticism being leveled right now at this government that, for example, there's no consideration for decriminalization. And in fact, you heard those questions, I'm sure, to the Prime Minister today from various outlets in which he said, this isn't a silver bullet, we're not considering it. Do you think that the government should consider it?
Well, it depends on what you want decriminalization to do. Decriminalization will not stop overdose deaths. What it will do is it will recognize that people who are using substances have a health issue to deal with. And we don't want to put people who have a health problem into jail. So simple decriminalizing simple possession by a user is what most people are talking about, so that you decrease the stigma of carrying not only the issue of being a user of substances, but someone who is also a criminal. And that is why people are calling for simple decriminalization of simple possession, but it will do nothing to stop the overdose deaths that we see until people get a safe supply of drugs. The minute you buy it, where the only place you can get it is on the streets, you will face the problem of fentanyl, carfentanil, and the benzos.
Yeah, and certainly we've spoken to a number of advocates over the last few months, and they have very much made that point, that it's not going to be one thing in isolation that solves the problem, that safe supply, especially right now, is of the utmost significance. But they are urging, and I'm talking about everyone from Dr. Bonnie Henry, down the line to people who are working with those who are addicted right now. They are urging that the government do consider that simple possession is decriminalized. Even the Canadian Association of Chiefs of Police. Are you frustrated at all? And I know that the government overall has taken a harm reduction point of view, but are you frustrated at all that there doesn't seem to be any willingness to even consider that?
Well, considering that, I mean, we cannot look at this issue from a national perspective, because every province is going to make a decision about whether they are going to follow decriminalization for simple possession or not. But what you have seen, and the movement that's a really good one, is the one of the prosecutor, federal prosecutor, saying, do not let us pick up people for simple possession anymore. Mm-hmm. Let's not do that unless added to it is breaking and entering and other criminal activity. But right now, let us not waste our time, because what happens is you stigmatize people. They're scared of being criminalized. They don't want to go and seek help, and they don't want to avail themselves of all the treatments and other things and safe supply and safe injection sites that they could avail themselves of. But I think the Prime Minister is absolutely right. It is not the answer. There are a multiplicity of things we need to do. But the most important one, I would say, having been involved with this for a long time and being a physician who dealt with patients who were addicted to certain substances, I would say that a safe supply is probably the single most important thing that we can do. And the federal government is engaging with provinces on that, especially the province of British Columbia, which is ground zero and which is actually has moved forward on safe injection sites, on having naloxone given to anyone who needs it so that they can stop an overdose deaths when it happens.
I just want to make sure that I'm clear on where you sit with respect to what the government should and can be doing, because I take your point on the engagement that's taking place with provinces, especially when it comes to safe supply. There are some critics who arguably say that engagement could be going faster. I do understand, though, that there are impediments and things that take a while when it comes to that. But I guess, to say that the Prime Minister is totally right in talking about decriminalization, there are a lot of people, including Dr. Bonnie Henry, in your province that say that there is a role for the federal government there, especially when it comes to the criminal code, that they could be looking at it, but that they're succumbing to pressure from Conservatives, for example, who will oppose that measure. What do you say to those critics?
I say exactly what the Prime Minister said. Let's keep harping on this as if it's a silver bullet, as if it's going to stop overdose deaths. And as the Prime Minister said, we are working with provinces that are willing and interested. Not every province is willing and interested. And the federal government cannot force some of this down provinces' throats. And that's one of the issues here about the chiefs of police saying, let's do a national decriminalization of simple possession. But what the federal prosecutor has done is by saying to all prosecutors across the country is, do not go out there and pick people up and give them a criminal record for simple possession, unless, of course, there are added criminal activity going on with it. And I think that is what we are trying to focus on, the immediacy of it. The problem, though, as I was saying, with safe supply is there is a safe supply project going on in British Columbia, but it's with pills. It's with the opiates that are pills. Right. And that's fine for some people, but the most at-risk people right now are the people who are on the intravenous drugs. And there is a shortage of those drugs around the world right now. Yes. We are getting some of it from Switzerland, but only a tiny amount. And so what we have to do is to think about how we get a distribution of injectable opioids.
Yes, I understand that. Yeah, no, that point is clear.
That's what's holding everything back.
Yeah, no, I understand that point. I think also, though, that the Prime Minister's defense, that his argument makes a lot of sense when you're saying that this isn't a silver bullet, that decriminalization wouldn't be a silver bullet, except for I don't think that's what anyone is saying. The people who have advocated for that on this show are saying that it could help prevent some of those overdoses, not that it would stop all of them.
I don't actually, yes, people may say it will help prevent. How it will help prevent is that it will not allow for people who are using, and as we decide this is a health problem and not for users, it's a health problem. For those who exploit the organized crime and the people selling on the streets, it is a criminal issue because they're doing criminal activities to exploit people who have a health issue to deal with. So I think there's nothing wrong with what people are saying, but the fact is that people are not recognizing that there are a whole bunch of other things that need to happen.
I'm out of time. Thank you, Dr. Fry. I appreciate your time.
Not at all. Bye.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.